right, let's dive into the signs and symptoms and the lab changes you might see with Lyme disease. So here's our perfect bullseye rash. So this, of course, we know does not always happen, but in a way it's so helpful if it does. So this really can highlight, hey, let's treat. This is really important. Report this to your doctor. So please look out for the bullseye rash. Now, Borrelia burgdorferi is an infection of the skin when we see this. So this is the first step that can happen before dissemination. But less than 50% of people recall a bullseye rash who have been diagnosed with Lyme. So that's very important. It doesn't always happen, or it doesn't always get recognized and found on the body. Now, this rash can develop 3 to 30 days after the bite. And we'll take a look at other pictures. It does not always look like this. This is pretty amazing if it looks like a bullseye, but it can look other ways. And really the diagnostic is that it's greater than 2 inches in diameter around the tick bite. So here we have other pictures of the Erythema migrans and how hard it can be to find it, right? So this is somebody's back of their shoulder. Now these rashes usually do not hurt or itch. They can be flat, macular. So someone might not even notice that. So really important, the 30 days after a tick bite, to check that site of the bite and ask for help, look in a mirror, make sure to look all over your body, of course, for tick checks, but also for that month after the tick bite. And then we see in darker skinned individuals on the right here, just how hard that is to find. That's an Erythema migrans on the back of a knee, also a hard place to find it. Here are other ways that the Erythema migrans can show up. So we have a lesion with diffuse borders, a larger lesion. It's hard to see there with the discrete borders. Then this large blister, and finally the disseminated rash. So this is when you have multiple target lesions all over the body. That is hard to miss. And they really do look like bullseyes when that happens. I've seen that many times. In Europe, we see a late manifestation of the skin with Borrelia afzelii. So this is Acrodermatitis chronica atrophican. So let's talk a little bit more about the signs and symptoms of Lyme disease. So first, the rash we talked about. So it can be pink or red, surrounding the tick bite. It may or may not feel warm to touch. It may or may not be raised. It could just be flat. There might be that bullseye or not. But it does spread outwards. So it might be solid, it might have different looks, but it would be migrating outward. So what I recommend after a tick bite, if you find a rash that's, not quite the 2 inches yet, but maybe in between a ½ inch and 2 inches in diameter, I would recommend drawing a line around that and taking a picture and keeping it for yourself or sending it to your doctor to alert them. And then if it does spread outward and go beyond that 2 inches in diameter, measure it, another line around that picture, and definitely reach out to a healthcare provider at that point, because that may be diagnostic for Lyme disease. Other symptoms, flu-like symptoms, fever, chills, sweats, fatigue, headache, swollen lymph nodes, especially near the site of a tick bite, joint pain or swelling, muscle pain, fatigue, stiff neck. And then early on, Lyme can affect the heart. So symptoms of this would be chest pain, shortness of breath, palpitations, and fainting. Lyme can also affect the eyes. You could have redness of eyes, itching or burning eyes, discharge, floaters. And neurological symptoms can happen within that first month. That would mainly be manifesting as Bell's palsy, which is a facial nerve palsy. And that's the drooping of one side, usually could be both sides of the face, due to loss of muscle control. So that happens early on, if that's going to happen. And my patients often, the first time they notice that is they'll be drinking something and it'll be dribbling down the side of their mouth. Or they'll take a look in the mirror and there'll be that drooping of the side of their face. Some other neurological symptoms, again, that can happen early on, but some of these might be more later manifested in the second or third month if it's not caught and treated. So numbness, tingling, the neuropathy. Also neuralgias, like burning, shooting pains, prickly sensations, weird sensations, crawling sensations. We can have cognitive changes, memory loss, mood or personality changes, seizures, confusion, pain with eye movements, ringing in the ears, vertigo, trouble with balance. And then labs that we might see if you were to get blood work in the beginning of Lyme, even before a Lyme test, during the acute phase of Lyme, if you had some blood work done, you might see elevated sed rate, elevated liver enzymes, and you could see microscopic blood or protein in the urine. But that all does not always happen. That is something you can look out for. Now with Borrelia mayonii, which also causes Lyme disease, you can see some other symptoms. You might see nausea, vomiting, and a large widespread rash. Interestingly, you can both see the Erythema migrans, which makes it similar to Borrelia burgdorferi, and spirochetemia, which means a large number of bacteria in the blood, which is similar to tick-borne relapsing fever. Let's take a moment to think about pediatric cases. So the highest proportion of new cases of Lyme disease happen in 5 to 9-year-olds. How it might be different regarding symptoms that can be manifesting or reported by children. Of course, it can be hard for them to describe what's going on for them in this age group, and especially a younger age group. So you might notice other signs in children regarding symptoms that might alert you to Lyme disease. Of course, there could be other causes for these symptoms, but really important because some of my cases that I've seen, it shows up more like this with young children. So developmental delays could be things like delayed speech or trouble with vision or motor coordination, processing. Children that have sensory integration problems. It might show up more so as a behavioral problem, also tactile sensitivity, and compared to adults, I see more digestive issues in children caused by Lyme disease. A kid that really loves certain activities and then they don't have interest in that anymore. They don't have energy. Sleep disturbances, fatigue, disinterest in activities they usually love. All of that could tell us there might be Lyme disease there. And early diagnosis is key for anybody. So it's really important because we want to prevent more serious disseminated symptoms. And by treating early, by diagnosing and therefore treating early, we're going to prevent chronic illness. There'll be a quicker recovery, and then there's less disruption to work, school, and family life.